Hello everybody. So today I want to talk about how much I've actually spent on my cat when it comes to unexpected vet bills. This doesn't include any routine stuff like the annual exams or the vaccinations. These are all the accidents and illness that happened over the past 8 years. And just to establish a baseline, my cat Lumos is a boy Ragdoll cat. He was born in 2017 July. I got him when he was around 3 months old, a kitten. He got neutered shortly after. All of that went through quite smoothly. There was really no issues at the start. One thing about Lumos is that he was always very active and affectionate as a kitten. And he's very motivated by food. I mean, this cat acts like he has never eaten anything in his entire life. And he's always the first who dashes to the automatic feeder. And he will eat absolutely anything that remotely smells like food, like the plastic kitchen towels that we use to clean up the counter, or anything that he can get his paws on. But yeah, so that's what he's been like as a kitten. So the first accident happened around when he was about 1 year old. This was around July, August in 2018. So that night, it was around 7 or 8 p.m. at night. I was walking towards the living room and I smelled something funky. It's not quite the cat litter or the poop smell, but it doesn't smell right. And then I saw Lumos crouching in a very weird position on the floor. He doesn't look like he was comfortable, and there's a piece of ribbon that was coming out of like underneath him. When I say ribbon, like just a piece of ribbon. It's probably part of like a perfume packaging or gift packaging. And then when I walked up closer, I could see that the ribbon was literally coming out of his butt. Just have that picture in your mind. Just imagine the shock when I first saw that. I thought I had like a seizure or something, that I cannot be looking at this right. But it was literally coming out of his butthole. And I tugged down it a little bit, which in hindsight maybe I shouldn't have, but then it obviously was painful for him and he darted away. And that's when I realized, oh shit, I need to go to a hospital. It's not something I can handle, that's for sure. So I called around. There are a few emergency 24-hour vet clinic around my place at the time. And the one closer to me, they have a 3-hour wait time. But there was another one that's further away and they were able to see him right away. So I took the cat there. The vet that took us in was wonderful. She was really professional, and she explained that we need to sedate Lumos first so they can safely remove the piece of ribbon. And thankfully, like, he was able to pass most of the ribbon by himself. So a lot of it was already out, and there wasn't a lot of piece that was stuck inside. So they were able to just remove it safely without too much complications. So that little hiccup cost me around $400. It was $90 for the consultation. The sedation cost close to $200, and then it was around $100 for hospitalization for under 12 hours. Yeah, so all in all, including tax, that was around $400 to remove that piece of ribbon. Everything today is gonna be in Canadian dollars. And then fast forward to 2023, and so that was right in the middle of COVID, and he would be around 5.5-year-old by that point. During the daytime, it was normal. He ate, slept, went to the litter box normally from my perspective anyways. But then at night, all of a sudden, he wouldn't eat. And now remember, this is a cat that just never said no to food of any kind. He didn't eat dinner that night. He didn't dash to the automatic feeder like he always did, which kind of caused me some concerns. And then he was hiding under the bed, which was another thing that's very unusual for him, because Lumos is a very outgoing cat. He would be the first cat that goes up to a random stranger that comes visit my place. He was never a shy cat. It's very unusual for him to hide like that. I had my eyes on him, but I didn't think it was an emergency at the time. And then later that night, he made this most agonizing sound that I've never heard from him before. It sounded painful. Something's definitely wrong. He was crying out in pain. So that's when I really kind of panicked a little. I wonder what happened, if there was anything I did or something he got himself into. Maybe he ate something, or I don't know. A lot of things were running through my mind. I took him to the emergency hospital So just be mindful that this whole entire, like when your cat gets sick, it's obviously a very emotional, draining process. So we got to the hospital, the doctor took him in, and after maybe half an hour, the doctor came out saying, oh, he has a urinary blockage, which was such a shock to me because I didn't even know that was a thing that could happen in cats. It happens mostly for male cats. So they gave me this pamphlet all about urinary blockage. So one way the vet would do when they take in cat with the suspicion, they would try to palpate the tummy area, try to feel for the bladder. And I remember the doctor was saying to me, like, his bladder felt very hard like a rock or something along that line. It doesn't feel like a normal bladder. That's one thing. And then they were saying because his urethra, so that's the opening where they pee from, was blocked by crystals. His bladder is very full, which is why he was crying out in pain. So this UTI, urinary blockage, it happens almost exclusively in male pets, so male dogs and male cats. It doesn't happen in female often because female urethra it's shorter and broader and it's harder for a crystal to obstruct, versus in male animals, cats and dogs, their urethra is too tiny, so like a tiny bit of dust would have blocked it. So if you have a male animal, it's something to be aware of. And how they treat it is that they have to push the catheter in through that very narrow passage and seal it in place, because cats are not humans, they're not gonna stay still, and they have to obviously sedate him in order to perform that procedure, and they have to hook him up to IV fluid to flush out the crystals to ensure that he's hydrated. So in my mind, it was just, oh my god, the most painful thing that my cat would have to go through to get this treated. Just like in my mind, I had this mental image of like a tiny baby in the NICU, like hooked up all kinds of tubes and wires. It was heartbreaking just to hear that he was in this condition. And for the whole entire time, I was thinking, oh my god, is that something I did? Did I do something wrong that caused him this illness? But the doctor was saying that this happens for a lot of animals without causation almost. It's idiopathic, so they don't know why it happens. That's the procedure, and then she gave me the whole lowdown of precautions. If his kidney is shutting down, they're not able to process the urine because the urine is, blocked. There might be potassium buildup and he might go into cardiac arrest. It was just, it sounded awful, but then there was nothing I could do, obviously. So I went through with the procedure. I left him at the hospital and I went home. I could barely sleep that night. And in the morning, around 6 or 7, the doctor called again, saying, he's all, I guess, as well as he could be, but he's not very cooperative. So, and he's peeing and pooping everywhere, and it's not recommended to sedate him because he's like an average weight cat, and they didn't want to put him under too much like sedation drugs. So they're saying it's the best if I pick him up and just take care of him at home, because they flushed out all the crystals at that point. So I was like, okay, I'll gladly pick him up. And then I also came up with this emergency bill, and this was the procedures and the process and how much it would realistically cost around the Canada, Toronto area if your cat or dog is going through the same process. The whole entire bill is around $3,000. Okay, the exam, the consultation fee was around $200. The CBC camp, so that's a blood test, that's $300. A urine analysis was $150. Collection fee, I don't know what that is, it's $50. Hospitalization with IV fluids was $400. And IV setup and maintenance is $200. It's interesting what they charge as an item. And rats, that's, I don't know, maybe x-rays, I'm not entirely sure what that is, so $200. Oh, the rats was $400. The catheter is $300. ECG, so that's, I guess, to monitor his heart, that was $126. Anesthesia, $100. They administered medication to him, that's like $40. And he had 6 shots of something, I think, 3 shots of painkiller, 3 shots of antibiotics. Each shot is like $40, $50. And then they also gave me antibiotics and muscle relaxers and just painkillers to take home with. Yeah, all in all, this whole entire bill. You're blocking? He's licking my camera, dude. Yeah, have fun. But yeah, all in all, this whole thing cost $3,000, right? By the time he came home, he was not well. He could barely walk. I let him out of the carrier. He was very wobbly. his arm is shaved and he looked like he's been through like a torment. There's a cone around his head. It was heartbreaking to see him like that. And he started peeing everywhere. I think that he's in pain or he still doesn't have full control of his urine process at the time. Like, I guess it's understandable. They just pulled a catheter out of him, right? So, but he started peeing everywhere and the pee was pink, which means there's blood in it, which means there's likely an infection or just because of the catheter caused the infection. It's a very, very painful process. And just from my friend, a human friend who had gone through UTI, and they tell me it's the most painful thing to experience. By the sound of it, it's not a fun process, obviously. So he started peeing everywhere. And I had a little robot at the time, and it has a very high platform that he couldn't climb into. So I put out a plain litter box for him to use. Yeah, he went down like that for a few days, but he barely ate anything. Also, I got like a feeder bottle just to feed him water, basically, just to make sure that he's drinking. If he's not eating, at least I'm making him drink something every day. And then I observed him very closely to see if he was peeing. Like, whether it's on the floor or in the litter box, I just wanted to know that if he was able to pee. That was the most important thing. That week, I was very sick from COVID or very bad flu at the same time. So it was hard enough for me to get out of bed. But then I have to at least remember to administer the medication to him. He didn't get better in that week, just from my perspective. Maybe I was just too depressed to see any sign of improvement. I was bawling my eyes out pretty much every day because he wasn't improving. He was too lethargic. He wasn't eating. He wasn't getting better. And I thought I was gonna lose him. He was only 5-year-old at the time and just too young to go. I was like, oh my God, am I such a bad owner? What did I do that I killed this beautiful cat? And I was crying on the phone to my mom. My mom is a nurse, and she said, you know what, let's go to the vet again. She was very comforting and she was supporting me all the way through. Let's go to the vet. So let's do a blood test. So a blood test will be able to tell you if his kidney is still functional, then it's just gonna take some time for him to get better. But it wouldn't be too big of an issue. But if his kidney is not functional, and then there's really not a chance for a cat to get a kidney transplant, and then maybe we need to think about the end. And then that really got to me because I know at that moment I'm 100% sure I'm not ready to lose him at that time. It was just very, very hard to take in. And at the time, my mom was actually sick herself. My sister was sick. My dad was the only one who was still healthy. I don't live with my parents anymore. Right, but my dad was the only functional, healthy person between the two households, and then he came over and helped me to make sure I eat, make sure my cat eat. I definitely have my parents to thank to help me go through this process. It's just not something I ever gone through before. To have a sick animal like that is honestly it's heartbreaking. So it was about a week from the initial emergency visit. We went to the vet again, and they tried to palpate for his tummy area. So just to give you a perspective, so they would go in here and try to kind of feel, I don't know how they do it, but they would try to feel around the tummy area to see if they can feel a lump or something, just to feel the size of the bladder. And the vet at the time, she was telling me like his bladder feels very small, which means he was able to pee at least. Which is a good news. But then they took a blood test, they did an X-ray to see if there's any crystals. And then they're saying that he's definitely lethargic, but maybe that's because he's in a lot of pain that he's not able to function normally. So from that exam, they prescribed like stronger painkillers. Okay, go. And they prescribed probiotics because he was taking antibiotics for a while and he was having diarrhea. So probiotics is supposed to help him build up the gut health to stop the diarrhea, and more just muscle relaxers in general. So the doctor was saying we should get him feeling more comfortable first, and then he will be able to heal, which is what happened. So that was that, and they did recommend to put him on a prescription or urinary diet. And just to back up a little bit, before this whole UTI incident, I was feeding them some like a little bit bougie diet. Like, it wasn't cheap. It was the New Zealand ZV diet. They use a lot of really good ingredients and like high protein diet. Like if you're just looking at the ingredient chart, I'll put it on the screen. Like I think they eat better than what I ate, right? But then he can't eat that anymore, and they recommended prescription diet. But if you look at the ingredient list of the prescription diet, they have like a lot of fillers, like the carrageenans or the carbs and things like that. So it's like, just in my mind, I thought, how is that gonna be helpful, right? We're feeding them carbs, but cats are carnivores. Anyways, for that year, I used pet store brand urinary food. I think it was Farmina, and there was Icelandic vet food brand that I used. For practical reason, I'm able to feed them once a day using the canned food, and the automatic feeder will feed them twice a day with the dry kibbles. So that went on for a year, but then again, like in 2024, so almost a year from the first UTI incident, it was around February 2024, I saw him to start pawing at the floor this morning. I was working from home, and then Lumos started to go around the apartment, and he was pat the floor. He was pawing it and taking a squat position. It looks like he was trying to pee, but nothing was coming out. And he was doing that like almost every other second. He paw at one spot, he wasn't able to pee. He'll go to another spot and paw it again, and then try to pee again. Nothing was coming out. I was like, oh shit, that doesn't look very promising. Since his first incident, I developed a habit to always try to rub his tummy. It's my very poor attempt to try to feel for the bladder. Honestly, most of the time I don't know what I'm touching at, but then if he's letting me touching his belly for a long time, that's most likely okay. It means he's not in pain, that nothing is wrong with his bladder. So that morning I tried again. I tried to pat his belly, then he didn't let me linger for that long. I was like, oh, maybe he's not comfortable. But then that time, he wasn't hiding under the bed like the first time. He was still like laying out under the sun. So he didn't look that stressed. But still, just as a precaution, better to be safe than sorry, I took him to the vet again. And sure enough, he was blocked again. But this time I went to my regular clinic because it was still during the day. And during the regular clinic, they were able to run the blood test and run the urine analysis. And I have this report. I don't understand any of these things. But then the report was saying there's struvite crystals in his urine. And I guess that's what the crystal is looking like for anyone who's interested in this. But yeah, he was blocked again. But the doctor at my regular vet, she was really good. Like, she was able to put a catheter in him and start him on IV fluid. And then I left them, I guess, for half a day and picked him up when they closed because I didn't want to go to emergency again. He was unblocked. So I took him home. We went through the same routine procedure, but the doctor recommended strongly this time, like, you've tried the pet food brand, right? It worked for a year, but it's really best to put him on the prescription diet, which I think I would agree. Because the thing is, during COVID, there was a supply chain disruption. Like, now I think back, I think that's probably what triggered the second incident. Because the vet food for urinary diet that I used to buy from the pet food store, they went out of stock. So I have to switch to another one. The other one wasn't probably as good. It was probably the change in that set him off. Versus a prescription diet would be a lot more consistent at providing the right food mix so that he's producing the correct pH. So I guess they also gave me this food-related pamphlet. So how do we prevent the disease is that we need to make sure the diet has low level of magnesium, and then we have to use diet that cause body to produce the correct urine pH to help dissolve the crystals and prevent UTI. So special dietary ingredients are used to do this, and these ingredients are not cheap, but these ingredients can be found in the prescription diet. I think it's essentially the gist. And also because I was feeding like a sort of bougie brand to begin with. So when I switched to the prescription diet, I think it actually saved me some money. It wasn't terrible. So the latest batch that I bought, it was a pretty big bag of dry food and I think at least 2 to 3 boxes of the vet food cans. Each box has 24 big cans. And that took me, I think $500. So the $500 worth of vet food lasted about 6 months. So if you do the math, you're averaging less than $100 of food per month for 2 cats, which is not a terrible deal, actually, now I think about it. So that's what they are now. So it's been, I think, a year and a half now. I think they're looking decent, looking healthy. I haven't really seen any alarming signs that's saying that UTI is coming back. Fortunately, knock on wood. I don't want them to come back. But yeah, so that's been the story. I know, and also UTI, it can only be managed by diets. I don't think there's a way to permanently treat it. And there is another way procedurally to make sure it doesn't happen again, but it sounds like the most painful process ever. So for cats that just continue to relapse, you could consider to do a procedure to remove the penis and make a female-like opening for your male cat. Because the urethra is too narrow in male cats. They have to surgically make it wider, which means they have to remove the penis to do that. And that's just, oh my God, you're basically castrating your cat twice by doing this. So they're doing this to prevent obstruction of urinary tract, but it does not prevent feline idiopathic cystitis. This means the cat is likely to continue to periodically experience recurring bloody urine straining, etc. So he could still get an infection. In fact, it's probably easier to get an infection now that they've done the procedure. Yeah, so it's actually mentioned in this article. Cats with the procedure, they are predisposed to bladder infections and infection-related bladder stones. The University of Minnesota currently recommends that male cats with this procedure done, like as in removing the penis and make a wider opening, have regular periodic urine cultures, even if they don't exhibit any symptoms. Expect a general schedule for your cat to have screening urine cultures at your vet's office. It's just, anyways, this whole section is just talking about the risks, but just based on the description, it sounds like it's going to cause a lot more problems than it's going to solve. Right? So I don't think I would ever want to go down that route. But I guess, yeah, so that's been the process. The first emergency vet visit was the $3,000, right? And then the follow-up exam was around $700. And the second vet visit for the relapse was around $2,000. So all in all, I've spent over $6,000 just for accidents and illness on this cat. And before anyone asks, I do not have insurance, but if you think about the math, right, $6,000 over 8 years that I've had this cat with me, if you average it out, it's about $50 per month for 8 years, which is about the cost of your pet insurance, right? And this is just for one cat. My other cat has been mostly healthy, knock on wood. Nothing really happened to her, thank God. And also now that he has this pre-existing condition, I don't think any insurance plan is gonna cover him anyway. So what I'm gonna do going forward is just I'm gonna set some money aside for both of them, just in case anything happens, right? And they are 8 years old now. They're technically senior cats, even though to me, I think they still look like kittens. They still have that kitten energy, but from my parents, because they come and feed them when I'm away, they're saying they do look like they are a bit slower than before, but I don't really see it in that way. But yeah, so I guess I hope you have some perspective now. If you have a male cats and dogs, and if they are going through this disease, and I share your feelings, and I just wanted to provide some perspectives regarding the early signs, the practical cost, and just the post-procedure or post-emergency care in that regard. I hope that's helpful to people. That's it. I think that's all I want to talk about today. It's a very long video, so thank you so much for staying till the end, and I hope your cats stay healthy and cute forever. Bye.